So I'm going to let you guys in on a little thing. I'm currently in a Facebook argument, as that happens with me often. When it comes to, you know, for one, I have just scheduled my surgery for my knee. It's going to be on the 20th of this month, which is a week from Monday. It's coming up very fast. And I'm in a group on Facebook that deals with ACL and meniscus injuries and is kind of an advocacy group for non-surgical options, which is great because they are sharing information on how to use conservative treatment, and then the end result, and this is where the kind of rub is coming up, is that there may be a point in any individual patient's path where you have to throw up the white flag and say, we've done everything that as far as conservative treatments go, and we are not seeing any changes. And so therefore we need to do the surgical option. For me, the reason why we're looking at the surgical option is not so much because of the meniscus tear, but because my knee keeps filling up with synovial fluid, which is the lubrication of the joint. And the synovial fluid, if you have too much of it in a joint, it actually can wear down the cartilage over time. And this is a fairly rare thing to actually have happen. It's normal, with an acute injury for the first couple months to have an excessive amount of synovial fluid in there. But, if you've had it drained, once or twice, and it still keeps filling up, I've had mine drained about 5 times since the injury, and it just keeps filling back up with fluid. So there is another condition going on there that warrants surgery. And if I were to mention that in this group, I'd probably get hounded and be told that, I need to get multiple more opinions. Well, this is the, I think, third or fourth orthopedist that I've seen. I have a sports medicine doctor that has looked at it. I have had done everything possible for the need to actually get it fixed, and nothing has worked. Nothing has made any difference whatsoever. So, we have to give the surgical option a try because that is literally the last option. And when it comes to, the advice that you find on the internet and a lot of the things that people do say, where ethics kind of come in is that when you are saying something in a way that, it's fine to say, get a second opinion. That's great. Get a second opinion from another qualified provider. That's perfectly fine. A fine thing to say and you can show people the data says that this is not, particularly promising to go ahead and do the surgery for this. But, when you have organizations like, or companies like Goop, which is Gwyneth Paltrow's company, or you have jackasses like Mark Hyman and whatnot that are out there, and they are giving advice that keeps you from treatments that are actually going to help you, then it becomes problematic. And this is something I learned probably a decade ago when I was doing one of my nutrition classes, where, when we say, okay, just do keto or just avoid gluten, right? If somebody has like a stomach upset thing going on and you tell them, well, you just need to avoid gluten, and they stop eating gluten and they think that they are cured, well, in that time they are not getting examined, they're not getting the biopsies that they might need. They might need an endoscopy, they may need a colonoscopy, any number of things to kind of diagnose this, because there could be cancer that's going on there. There could be H. pylori, which is a bacteria that causes gastritis in the digestive system, that could be there, that's causing that stomach discomfort and stuff like that. And so there could be something going on there that you don't know about, and you've just told somebody, just don't eat gluten, and now suddenly they're trying to cure something with a fix that has nothing to do with the actual problem. And that's where things become highly unethical, right? So, yes, when we talk about things that are medical, nutritional, or things like that, we really want to make sure that we are framing things in a way that is educational, that gives people accurate information. But we always have to be careful about how we say it and how we respond to it. When it comes to these people in this group and how they're pouncing on this one person who had a physical therapist say, you need to have a surgical intervention on your ACL tear. or else your cartilage is going to deteriorate, and then everybody pouncing and saying that that information is extremely false. It's highly unethical because you haven't examined the knee, right? Even if you are the best knee doctor in the world, you haven't done the examinations yourself. You haven't seen the MRI, you haven't seen the x-rays, you haven't seen anything. You do not know everything that's going on there. So the person who's giving that recommendation, who has had literal hands-on that person, that where they've actually done some type of inspection on that person, they are probably in a better position to understand what's going on. Now, this could be a person that, a physical therapist that's just not keeping up on the surgical research, and therefore saying, get a second opinion might be the more appropriate thing to say. But when it comes to everybody just pouncing and saying, that person is flat out wrong, you can't say that because you don't actually know all the factors that's going into that suggestion. So you can point out, what the data says. You can point out a lot of things, but you can't say that they're wrong when you haven't done any type of, investigation, and if you don't have the qualifications to actually look at that issue. So that's what I have to say on that issue. And yeah, I'll be back in a moment.